Hey guys, Katelyn here. And for this week's YouTube video, I wanted to talk about pediatric traumatic brain injuries. So I had two patients come in on the same day, and both of them were kind of more complicated pediatric cases. They fell and hit their head, and the parents were concerned about some sort of brain bleed. So my first patient came in, she was jumping on the trampoline. She was 4 years old, if I remember correctly. And she was jumping on the trampoline and she had a fall and she fell off of the trampoline, hitting her head on concrete. The parents were just like, oh, we're just gonna keep her, watch her. And then she started profusely vomiting. And so that was a very difficult case that we had to run through the PECARN pediatric rules for imaging for these patients because imaging pediatric patients is a controversial matter for sure. And then my other case was this little girl. She fell and hit her head the day before. She was around 7 years old and she was acting completely fine, no symptoms, no loss of consciousness. But her mom noticed that one of her eyes, the pupil was larger than the other one and it was ever so slight. So we ended up imaging both of these patients. And I will tell you why with the PECARN pediatric rules for head imaging. So let's get started. So radiation and children's brains don't exactly get along. There is a lot of research that shows that a large amount of radiation when a child is very small puts them at risk for central nervous system tumors later on in life. And there's also been literature that shows they have an increased risk of declining cognitive function later on in life. 50% of children that come to the emergency department get CT scans that are unnecessary. Now, it is very hard to make this decision, so that's why the PECARN rules were put into place. A child's head is, in their brain, is just more sensitive to radiation at a smaller age, so we need to apply these rules. And it is also important to remember that observational periods, time where the parents watch the kids, watch for symptoms, and even in the emergency room, we watch for symptoms prior to the CT can be used as well. I actually used an observation period with my child that had a lot of vomiting. We were just like, well, if she hasn't vomited here in the emergency department yet, let's see how she does here. And unfortunately, 30 minutes later, she was vomiting again, and that's why we did the CT with her. So let's talk about these PECARN rules. So when using the PECARN rules, what I like to do is bring it up in the room with the patient and the family. I like to use a shared decision making with every family member, and I always talk about the rules and the risk benefit analysis that goes along with obtaining a CT, and I always talk about the risk that go along with it as well. So what I do is I bring up the computer in the room, and or if there's no computer, I just bring it up on my phone. I Google PECARN, and I usually use the link from MD-Calc because MD-Calc lays it out in a way that it's a stepwise fashion. So with PECARN rules, it's separated into two big categories. If you're less than 2 years old, you're going to have certain criteria, and if you're greater than 2 years old, you're going to have certain criteria. And then, so they're going to ask you how old is the patient, and then you click that, and then MD-Calc will go to the next set of questions, and that is the Glasgow Coma scale less than 14? Do they have any sort of altered mental status, or if they have any sign of a skull fracture, including a basilar skull fracture? So that's that battle sign back here, raccoon eyes, or if they have a lot of rhinorrhea coming from one nostril, that could be a CSF leak. So definitely evaluate the scalp of these patients to look for those, or if there's any blood behind the tympanic membrane. So always look in these little kiddos' ears. So if they have any signs of those, then they do recommend a CT, as there is a 4.4% risk of a traumatic brain injury in these patients. But if you say no, which is a majority of your patients, and it was the majority of my two patients yesterday, then you go on to the next set of questions, and that's where it varies between if you're greater than 2 or if you're less than 2. And I never remember them right off the bat. But it goes along with loss of consciousness, a lot of profuse nausea and vomiting. If they fell from a dangerous height, which is greater than 5 feet. So my little girl that fell off the trampoline did fall from a greater than height of 5 feet, and various other things. And like I said before, I always bring it up in the room, and I let us as a group make this decision. And that is exactly what I did with those 2 patients yesterday. So just to kind of tell you the outcome of my 2 patients, though I was a little more concerned about the little girl that fell off the trampoline because it was greater than 5 feet and she was having a lot of profuse nausea and vomiting. And we actually saw it in our emergency department as we did try that period beforehand of observation. And so we ended up scanning her. After that, we had before that we had a long discussion with her family, and they were okay with the observational period. They didn't want to do any increased radiation if they didn't have to. They were completely trusting us, which was awesome. But then she started vomiting again, so they wanted the CT scan at first. So it didn't show anything. She ended up going home and doing well. We called her the next day. She was feeling better. And then my other little girl, this is the girl that had a pupil size greater than 1 on the other side, and it was ever so slight. But this little girl literally had no symptoms, no loss of consciousness, no nausea and vomiting. She was playing in the room. She wasn't complaining of a headache at home, but then when she got to the emergency department, she kind of was. We talked about risk-benefit analysis with her, and we talked about how anisacchoria can be normal in up to 20% of the population, and the mother really just wanted the CT scan with her as well, and it ended up being fine. So that's the outcome of both of those. It's really not a hard decision when they come in altered or they have any sort of fracture to their skull. You're going to get the CT scan at that time. But it's those tricky cases that they're going maybe a head CT or maybe observation. At that time, it's just a long discussion with the family and the patient because the parents are going to be a second patient at that point. And I always like to compare the PECARN rules to the Canadian head CT rules that you see in adults, because a lot of the same symptoms like nausea, vomiting, loss of consciousness make you order a CT scan in adults versus maybe you order it in a kid. So just take a look at those. I always like to use MD Calc for those. I find them very helpful. I hope you learned a little bit today, and I will see you guys next week.